Tell me about Menieres disease.
Sure. Again, the history is everything. With Menieres disease, you are going to now have the auditory along with the vestibular. But the difference is with the auditory, there's frequently tinnitus or tinnitus, and you can have that even with the vestibulitis. But the hallmark of the vertigo with Menieres is that they have spells of it. It comes on out of the blue. Typically lasts for 3 or 4 hours, and they're as sick as can be with nausea and vomiting. Fortunately, the vertigo goes away after a few hours, and it doesn't make any difference what position their head is in. So it is a recurrent condition. The hearing loss can be
So there is hearing loss with it?
Yes, and usually low frequency, which is kind of the opposite of what people like you and I get with high frequency, and tinnitus along with it too.
And what is tinnitus or tinnitus?
Well, tinnitus, again, anytime a nerve is injured, we think of a nerve as a transmitter. When it gets injured, it becomes a generator. So it generates its own signal. And that's the cause of numbness and tingling in your feet or burning. But in the auditory nerve, we refer to as that noise the nerve is so-called making is tinnitus or tinnitus.
Certain kind of noise? Is it more of a blowing noise or a tingling noise? Or
You just have to ask the patient. Yeah. And
they all get different noises, don't they?
Everybody tells you something different.
Treatment for Menieres and for benign positional vertigo?
There is treatment. It's entirely different than the benign positional vertigo because you can go through all the head hanging positions. That's going to do nothing for them. But with Menieres, the first treatment is get them on a low salt diet. And this is really a low sodium because salt and sodium, as you well know, are two different things. So they have to be on a low sodium diet, frequently at least no more than 2 grams a day, maybe even a little bit less, 1,500. Want to make sure they're drinking plenty of fluid so they're not getting dehydrated and then get dizzy when they stand up, and frequently a diuretic. And there's many people with this, with Menieres, that will have a fairly good response.